What I will respond on that concerning like parents who are not like paying. To me, I was like putting as a suggestion that it should be there, that you pay as a part of it. Though you are paying the school fees, but you have to put as a priority. Actually, it should be like a priority that that part of that contribution it should be there. So it's not a must, just it's like a willing, so that we make sure we deliver the right services to our children. So this is a response that I have for that question that you have imposed to me.
Yeah, thank you so much. Thank you so much. Yeah, you want to add?
Yeah. Okay, let me add in something small based on the question that you asked, that are parents really following up when it comes to that areas of because sometimes parents pay the contribution for health, but is the school administration implementing that money for the health in the areas of menstrual hygiene and management? Are they considering?
Yes.
And are the parents also following up? Basically what I can say is that sometimes most parents they don't follow when it comes to such areas. Most parents they don't follow, and you see actually in our context in Yei, particularly here in South Sudan, you see due to the conditions, sometimes parents they don't follow up. Most of the parents they don't really, to be honest, they don't follow up. Yeah, so that's the challenge I've seen. But majorly, what I can say is that the school themselves should really understand that if parents have contributed in the areas of the health, it really needs to be considered, because it's not really good for them also to receive the contribution for the health, and they are not putting it into work. It will not be helpful.
Yeah.
Yeah,
Okay.
thank you.
You said some of the parents they cannot follow up their contribution. Do you think there is a when they do follow up, is there a response or there is no response? What could be the problem that make parents not follow up on the contribution that they are the one contributing? What could be the problem?
Yeah, you see, if it comes to such areas, you see, an individual alone cannot work alone. I think what will work best for the parents is to form alliance, like during the meeting when such concerns is raised. Then they have to talk about it, and they put it as a concern, so that they follow up. Yeah, so that they follow up with the school administration, so that their money goes in the right place. Because otherwise, if really they don't follow up, it becomes hard. But I believe if parents follow up with the administration, at least there will be a change. And because following up is already giving an alert to the administration, and making them aware, and is even scaring them. They will really know that yes, these parents are they are very concerned about the progress of their girls. And I believe with that it will really work. And what I will really advise that we as parents, we really need to come together, and we also need to do follow up on such cases, so that our contributions receive the right places.
Yeah, thank you so much for the addition.
So I want to add something on what my fellow has said concerning the parents who are not like doing follow-ups for what they're paid, like as package to those people in school, especially the girls. So simply, I want to respond in a way that you see, most of these parents they are adamant and they don't care. You see, not all parents they have the responsibility of taking care of children. So with what I have seen, it needs that the school alone have to set like their own duties concerning that program. If for the parents who are not following, I think if they fail to follow, and then the duty of the school alone, it can follow such program, so that you can put right what's for those children. So this is basically my response on that.
Okay, thank you so much. I just also wanted to get something small from you so that I can understand. Do you think all the parents, all the schools are having that healthy, that line of health whereby they engage parents to pay some contribution for health? Do you think all of them have? Or those, let me say, the private schools or the government schools, the community schools, Do you think all of them have that line? Because I believe if they have that line, these issues of menstrual hygiene management could be also responded through that process or through that contribution that parents are contributing towards menstrual hygiene management. Are you really sure that all these schools have this program online?
Let me respond on that. To me, I will not say yes or no. According to my understanding, it might be only a few schools who are doing that. Because those cases I am seeing in most of the schools, those programs are not there. Yeah, it will be there in a lesser percentage. So this is my response.
Yeah, thank you.
Yeah, maybe a small input is that, sometimes also I may not say all the schools are having maybe the healthy line program in their admissions or not. But to the best of my knowledge, I know healthy is a priority that all schools must consider or adapt into their system, because that's a whole system of a human being. So where there are people, it means health is important. So basically what I can say is that I'm not sure whether all the schools are having the programs in their system. But what is important is that what the parents are contributing, the school administration should really take a priority and consider it as something important, so that girls will really get a right time for classes in schools. Yeah.
Thank you so much for the responses that you people have given me. You know, it's good for us to understand our community, so that when there's some programs that we wanted to develop together with the community, government, and even the partners, we will be able to develop those programs that can suit really the gaps that are affecting our community. Thank you so much. We are going to our last questions. I'm sorry that it is taking us long to answer these questions, but we also I'm really so happy that you people are committed to these discussions, and it is the discussion that can make us to come out with some durable solutions that can support menstrual hygiene management in school as well as in the community. So our third question goes like, what should the government and the other stakeholders do to improve menstrual hygiene management in schools?
Thank you. Well, let me respond like this to that question. To me, personal, looking at the government as one of the key stakeholders when it comes to the areas of health, even measure all the areas in the country or in the system. Government majorly is a key stakeholder when it comes to that, so menstrual hygiene and management in schools. To me, I really want to pass in my message to the government that government need to bring in a policy that is to be included even in the curriculum of the nation, in the curriculum of that country, so that it is a policy that can be adopted by all the schools, can be implemented in the schools, so that it becomes something that people lives with. Because if it is already a policy being put by the government, I think all the institutions will comply to it, and it will work. Then that way it will help our girls to really be able to attend schools. Then another thing that I will also talk about is that the government also need to contribute by supporting the schools, mostly, majorly the government schools. The government needs to bring in those menstrual kits and building in the private places for girls and boys, so that when girls are on their menstruation, so that they will be able to access those necessities like the worst facilities. The girls need to have clean water, soaps, and so on in those shelters, in their places, so that when they are menstruating, they will go in and clean themselves very well. At least that way will also help so much. Also, one thing I also want to add is that the government need to create in awareness. The government needs to really design awareness program in the country, and that can help at least inform other stakeholders, even like the parents.